In the heart of Europe, arguably one of the wealthiest, most medically advanced, and resource-rich regions of the world, thousands of people continue to die each year from infectious diseases that should no longer be fatal. HIV, viral hepatitis B and C, and tuberculosis remain among the leading causes of preventable deaths across the EU and European Economic Area. Despite well-established treatments, preventive tools, and even outright cures in some cases, these diseases persist, and with them, the avoidable loss of human life. The recent report from the European Centre for Disease Prevention and Control, ECDC, paints a sobering picture that contradicts the illusion of comprehensive healthcare safety across Europe. The reality is far more fragmented, and in many cases, dangerously complacent. Hepatitis C stands as perhaps the most tragic example. More than 35,000 deaths annually in Europe are attributed to complications from this virus, deaths that are unnecessary in nearly every case. In the vast majority of patients, hepatitis C is curable with modern antiviral medications, often in as little as 8 to 12 weeks, with minimal side effects. Yet treatment gaps persist, driven by insufficient screening, lack of awareness, and systemic failures in public health outreach. If a person never gets diagnosed, they never get treated. If they're marginalized due to substance use, poverty, or immigration status, they may never be reached by the systems that should protect them. That these lives are still being lost in 2025 is not a failure of medicine, but a failure of policy, priority, and equity. HIV continues to kill over 3,000 people annually in the EU and EEA, despite decades of medical advances. Antiretroviral therapy can now suppress the virus to undetectable levels, allowing people with HIV to live full, long lives and avoid transmitting the virus to others. Pre-exposure prophylaxis, PrEP, can prevent infection altogether, but uptake remains uneven. Fear, stigma, and lack of access, especially among vulnerable groups such as migrants, men who have sex with men, and sex workers, continue to undermine progress. The tools are there, but the social and political will to deliver them universally remains inconsistent at best. Tuberculosis, a disease often dismissed in the West as a relic of the past, is still very much present and deadly. With 3,550 deaths reported in 2023, it's clear that TB remains a threat, particularly in populations experiencing homelessness, incarceration, or migration, where overcrowded living conditions and limited healthcare access facilitate transmission. Most TB cases are treatable with antibiotics, especially when diagnosed early. Yet delayed diagnoses, drug-resistant strains, and incomplete treatment courses continue to drive avoidable fatalities. The global goal of eliminating TB as a public health threat by 2030 now appears increasingly distant. Hepatitis B is another area of striking contrast between potential and reality. Effective vaccines have existed for decades and are part of routine childhood immunization in many countries. Still, 15,500 people in Europe died from hepatitis B-related complications in 2021, according to the most recent ECDC data. For those already infected, antiviral therapy can suppress the virus and prevent liver failure or cancer. And yet, here too, the systems in place often fail to reach those most at risk. Missed vaccination opportunities, weak follow-up for chronic cases, and under-resourced primary care networks all contribute to these deaths, none of which should happen in a system that aspires to universal health care. This pattern of neglect has broader implications beyond the individual lives lost. Each preventable death reflects not only personal tragedy, but also public health failure. These diseases impose long-term burdens on families, strain healthcare systems, and increase the risk of future outbreaks. The ECDC's own warning is clear. The global community aimed to eliminate HIV, viral hepatitis, TB, and sexually transmitted infections as public health threats by 2030. But as we approach the critical 2025 milestone, many European countries are not on track. Too few people are being screened, diagnosed, vaccinated, or treated. Too many governments are underfunding outreach, surveillance, and harm reduction programs. And too often, Progress stalls because infectious diseases that disproportionately affect the marginalized are allowed to persist in the shadows. Some may argue that the COVID-19 pandemic diverted resources and attention away from these long-standing threats. And it's true that the pandemic disrupted health systems in unprecedented ways. But the current crisis is not just about recovery. It's about long-standing systemic neglect. Unlike COVID-19, these infections are not new, mysterious, or complex to treat. What they require is not medical innovation, but political will, investment in prevention, access, and inclusion. The medical community knows how to end these epidemics. The question is whether the public health infrastructure and leadership will rise to meet that challenge. Infections like HIV, hepatitis, and TB do not persist in Europe because they are invincible. They persist because the response to them is incomplete, uneven, and often too late. Without rapid course correction, the goal of eliminating these diseases by 2030 will remain an empty promise. The next 5 years must be treated as the final, urgent opportunity to act, not with complacency, but with the determination to turn preventable tragedies into triumphs of public health. Anything less is a moral and medical failure.